Partnerships for Health is a program that we have here in the Southwest LHIN. It's a 3-year project, in fact, where we're working with providers that support individuals with diabetes care to look at how they coordinate care across the various sectors to ensure that patients receive the best possible care in their communities. The focus is around the care team and looking at how they work across partners like primary health care, the Community Care Access Center, diabetic education centers, community support programs, including those that support individuals with mental health and addictions. I think the LHIN was really an enabler in this process. We were presented really with the opportunity to seek outside funding through the Ministry of Finance through their Strengthening Our Partnerships initiative, and we were very fortunate that they worked with us in the Ministry of Health to support this initiative. We really helped put the business case forward to secure the funding, and we've continued to provide guidance and leadership to the project.
It starts out just with relationship building and creating trusting relationships and creating a team in a way that otherwise doesn't happen naturally. It takes dedicated time and effort and a commitment to work together in a different way, and Partnerships for Health facilitates that. From the patient's experience, they're getting that sort of system navigation in a way that is much more helpful and meaningful for the patient. Some of the outcomes revolve around the improved team understanding and role clarity. So physicians have been surveyed through the project, and 100% of them in a recent survey identified that having the CCAC involved in this more comprehensive way as a member of the care team added value to the care that that physician was providing to clients. We also know that more referrals are happening. So more referrals for the CCAC in-home services, but also a huge increase in the number of referrals and connections that through us are being made to other community agencies out there. So that's a clear indication that there were gaps in service delivery before that are being addressed now. We have tracked of our CCAC patients with diabetes that there has been a reduction in the number of visits to the emergency room as well as the number of hospital admissions in just the very short time we've been involved in this project.
Some of the key success factors for making this program work from an integration point of view is what I have seen that's excited me greatly when I see these teams in action is that physicians are really feeling that they are part of a team now, that they have other people that they can work with, either if they're in a family health team or community health center environment, or even out in the community practicing on their own or with 1 or 2 other physicians with maybe only 1 nurse. They're finding out who's in the community that they can work with and to provide a much more comprehensive care package for these patients.
The need is great in the Southwest LHIN, but also across the province. So we have an escalating aging population, and with that comes chronic disease. And what we need to do as a healthcare system is try to help people look after themselves better and delay some of the effects of chronic disease that are so common with aging. That helps our health system, and it helps to sustain our health system, but more importantly, it helps our aging population have a better quality of life, which is really what we're all here to do. The project's been going on for about 2.5 years now, so we have almost 60 practices enrolled across the Southwest LHIN in this initiative. And so those are physicians and their colleagues in home care, diabetes education centers, mental health, pharmacy, and other community providers, all interested in putting extra time and energy towards improving care for their patients. There are fears about integration, but in practice they're not realized. Sometimes people fear a loss of autonomy, either clinical autonomy, perhaps they feel that people are watching them too closely if they integrate their efforts and work with other people in the team. But what we find in reality is that there's less duplication, that people work together collaboratively, that there's lots of work for everyone to do, and that the patients have better outcomes when people are working together, sharing information and trusting each other to fulfill their respective responsibilities as a member of a dynamic team.